So in northern Gaza, the World Health Organization is calling for an immediate end to Israeli attacks on the last functioning hospital there. For nearly 80 days, the north has been under siege in a campaign widely described as ethnic cleansing. Scores of patients suffering from chronic conditions lie crowded in the hallways of the Kamal Adwan Hospital, with very few doctors to treat them and under constant threat from the Israeli military. Essential medical supplies have run out, and the few supplies that are remaining are in critically short supply. Yes, and gunfire and artillery shells are being heard in the vicinity of the hospital. Israeli forces have surrounded the facility with drones and tanks and have ordered people inside to evacuate, but there is nowhere safe for them to flee to. The director of the hospital has issued an urgent appeal.
The Israeli military has targeted the Kamal Adwan Hospital with different types of weapons without prior warning. We are being directly attacked. The ICU unit, along with the maternity and nursing departments, is coming under fire. The bombing is being conducted with tank fire and quadcopters, directly targeting us while we are present inside the hospital departments. We don't know why we are being targeted at this hour. We have been informed that the hospital will be evacuated in the next few hours. This is catastrophic because we are the only hospital providing services here in the north. Evacuating the hospital means evacuating 66 patients and all of the hospital facilities and the medical staff. We had asked the world to intervene immediately and protect the healthcare system from this brutal attack. For more than an hour, the shelling continues. We hold the world accountable.
Well, let's cross straight away to Hani Mahmoud, who's in Deir al-Balah in central Gaza. And Hani, the hospital has been under relentless assault for months, but what's happening now is evidently more extreme and more deadly than ever.
Absolutely, and what we're seeing unfolding in northern part of the city, particularly at Kamal Adwan Hospital, this health facility is the pinnacle of the past weeks of relentless attacks and constant bombardment by the heavy artillery that is the vicinity, by the planted explosive devices that surrounding the areas from all sides of the facility, preventing and impeding movement of ambulance, impeding movement of people who wanted to carry the injuries from the bomb site into the hospital. But here's what we've seen last night as the most fierce attack on the hospital. It seems to be deliberate. It seems to be on purpose, just to completely push the facility out of service completely. It started with the quadcopters surrounding the facility and calling via the loudspeakers on everyone inside the hospital, who, by the way, are only 60 people inside the hospital. That includes the director of the hospital, Dr. Hossam, the medical staff who's working with him in these difficult conditions, and the patients and the injuries. For the past month almost, none of the people was able to get to the Kamal Adwan Hospital, giving the danger surrounding the areas, the quadcopters, the drones that are, again, preventing people from approaching the hospital, reaching to it. Also, the injuries who needed immediate medical care could not get to the hospital. There is one incident where bombed homes at the vicinity of the hospital, none of the medical staff, none of the people in these bombed homes were able to rescue or save any of the people. People arrived at the gate of the hospital in the past few weeks and were shot and attacked by the quadcopter. So everybody inside the health facility, known by the Israeli military, the director of the hospital, the medical staff, the injuries and the patients inside. Yet the narrative kept pushing into the hospital, housing militants, housing members of Palestinian resistance, and that's why the operations was unfolding. But what we're seeing now is a deliberate attack on the health facility, its upper floors, on its power generators, on the solar panel system, the ICU. There are essential departments of the hospital have gone completely out of service. Its ICU, after the attacks, rendered non-operational, now forcing everyone everyone inside the hospital, as we heard from Dr. Hassam Abu Safiya, the director of the hospital, to gather in one area away from the windows, from the areas that are exposed to the tanks, the armored vehicles, and the quadcopter. And despite all of this, they were experiencing much of the difficulties throughout the night by the bullets that penetrated and pierced through the walls into the equipment inside the hospital. Many of the injuries reported inside the hospital. What the Israeli military wanted from everyone inside the hospital to evacuate immediately from the hospital, but it also created a very intimidating environment and conditions to the point where people felt it was difficult and unsafe for them to leave.
Yeah, a very, very frightening situation. And indeed, it's not only the hospital that's been targeted as ever. Tell us about the other strikes.
Well, almost simultaneously, while the hospital being attacked relentlessly, the Israeli military also carried out deadly attacks here in the central area, a residential home full of displaced individuals. These are three families that happen to be in this particular residential home in the eastern part of Deir al-Balah city was bombed relentlessly. We happen to live in the surrounding area. We could feel the land, the earth shaking by the intensity of the explosion that happened. 5 people removed already from under the rubble. Part of them were removed in pieces. Those are the children of one of the families inside the home. 6 are still trapped and missing under pile of rubble as a result of the attacks. And within just a span of an hour, another attack in Gaza City, where an evacuation center, that's a school, Honorable School, been attacked in the eastern part of Gaza City in a Daraj district. And this is not the first time we're seeing this particular neighborhood being attacked by the airstrikes, but 8 people reported killed and more are still missing and trapped under the rubble. As eyewitness described, that part of the facility was completely destroyed by the bombs that were dropped on the school, and it kept evolving into a very difficult scenario right now, as many people with the critical injuries are arriving to health facilities, but they don't find the proper medical care needed to save their life. Injuries arrive with severe bleeding, severe burns, as these bombs packed with nails, with pieces of metals, and when they explode, they pierce it through the flesh and cause severe bleeding, making it very difficult for medical staff, particularly at this time where there are no medical supplies available or medical care or pain medication to intervene and provide proper medical care and provide health care needed for these people.
All right, Hani, thanks for that update there. Hani Mahmoud, reporting from Deir al-Balah in central Gaza.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.